Good morning. And now for something a little bit different, we're going to show you how at Vitals we're bringing transparency to healthcare. There was a time, not too long ago, that when we bought a car, we didn't know too much about it. We had to trust guys like this and hope that we didn't get a lemon. But now, through the magic of search and the internet, we have sites where we can read reviews, comparison shop, and know how much we should pay for the car before we ever even enter the dealer. The internet has flipped the purchasing power from the seller to the buyer. Of course, the internet hasn't just remade the car market. All kinds of industries have been transformed by empowering consumers with more information about their choices, including quality, cost, and access. Travel, restaurants, fitness, investments, even the process of finding a mate or significant other. Yet we still don't see this level of transparency when it comes to one of the most important decisions we have to make: taking care of our health. Everyone in this room has probably felt confused about a health decision they've had to make, whether it be choosing a doctor or a health insurance plan, which, by the way, as bewildering as it is, it's about to get even more confusing. We don't know if one treatment is better than another. Do we need transplants, hair plugs, medications? Not so sure. Also, we never know what it's going to cost us when we go to a doctor or a hospital. Think about that for a second. Is there any other transaction or decision in your life in which you not only don't know what it's going to cost, but it's considered taboo to even ask? Imagine if you were to ask your doctor how much the procedure he or she recommended is about to cost, or why the doctor across the hall is willing to do it for $500 less. Most of us rely on friends, relatives, or neighbors when making our healthcare decisions, or insurance directories. Remember these? Yet many people still find it difficult to determine a good fit when it comes to choosing a doctor. And when they do, it's often by chance. But choosing a doctor, one of the most important decisions we make, shouldn't be left to the odds. That's why we created Vitals, to harness the power of information to reduce the anxiety of choosing a doctor. We collect millions of points of data on doctors and put it through some complex technologies so that you can understand it. Everything from education to hospital affiliations to specialties and areas of expertise. We build profiles that have more than 64 points of data, 64 different things that you might want to know about your doctor, from office locations and hours to awards they've won, languages they speak, clinical and research interests, and published articles, even a video profile. We think we're doing something right as we've now become the largest online doctor directory, helping over 13 million patients a month or 130 million patients a year find a doctor. And we do this for every doctor and dentist across every specialty in America, at least the ones that are active, practicing, and still breathing. Why? So you can find the right doctor at the right time. And we pair it with patient reviews that give you insight into a doctor's bedside manner, follow-up care, friendliness of the staff, how easy it was to get an appointment, and how long you had to wait once you got there. In fact, Vitals has nearly 3 million reviews. That's more than any other site out there. And we've created awards for doctors because we learned that sometimes things are a little more important when choosing one specialist over another. For instance, you may want an OBGYN, pediatrician, or internist that has a great bedside manner, is compassionate, while you want your surgeon to be much more advanced in the latest techniques, have the highest procedure volumes in whatever surgery you're going for. The criteria is going to be different, and that's what we try to give you the criteria so that you can make that individual decision. We do this all so that your search for a doctor is less confusing. And because people who like their doctor are generally healthier, they're more likely to go to their doctor's appointment and keep them, and they're more likely to adhere to their drug, monitoring, or treatment regimes. So what about finding Dr. Right? We looked at all the various doctor types out there in an effort to try to categorize them. You recognize anyone up here? How about your own favorite? We found 5 different doctor archetypes that people are drawn to. These archetypes were compiled through a survey we conducted with Harris Interactive last fall. More about these types in a minute. We found some surprising statistics that people really do have a hard time finding the right doctor. In fact, most people find it harder than finding a good nanny, choosing a college, finding a place to live, planning a wedding, or even finding a new partner. And we found that people really valued time over technology from their doctor. They'd rather give up fancy equipment and diagnostics for a good listener. And people cared less about their doctor having the best academic credentials and more about having a personal connection with their physician, which is important because at the end of the day, we want to find that doctor that is motivating us to be our best, healthiest self. Wait, how'd that get in there? So who are the doctors that can motivate and inspire us to better health, that we can actually connect to? Once again, we boiled it down to just 5 doctor types. There's Dr. No Nonsense. Smart, confident. He relies on evidence-based medicine and statistics to help him come to a quick diagnosis. He's not warm and fuzzy. In fact, his bedside manner may need a little work, leaves a lot to be desired. And he appeals mostly to young to middle-aged males. Then there's the idealist. The idealist wanted to be a doctor since he was 6 years old. He's more likely to be at a small group practice and be your kid's favorite pediatrician. He's also most liked by young adults and students. Then there's the sage, an older doctor, years of experience, colleagues that look up and respect him. And it's no surprise that older adults like this doctor type the most. Then we have the trailblazer, always on the cutting edge of medicine, toting his iPad around to exam rooms to help explain a diagnosis as well as look up new drugs and treatments. The trailblazer was strongly preferred among college-educated males. And last, and certainly not least, is Dr. Whole You. She got her name as a holistic healer, more likely to use a blend of techniques from both Eastern and Western medicine. She was also the hands-down favorite among women, preferred over 4-to-1 over any other doctor type. Of course, everyone here has their own personality, but the days of blindly finding the right health care are behind us. Vitals helps people find a great doctor today by giving some search filters that allow you to customize your search for what's most important to you. And we're letting you know when you can see that doctor and how long you'll wait. In fact, for the last 4 years, we've put out an annual State of the Wait report on which states and cities have the longest doctor wait times. As you can see, we've gotten some great press as a result of this. And if you're interested, we have the results up on our site, but Alaska has the shortest wait time, while Mississippi has the longest. And in a preview of some exciting new things to come, we're working with some of the top insurance companies to bring price transparency to their members, to you. This is something that's part of every other customer experience. Specifically, we're now going to be able to tell you what your visit will cost based on your specific individual plan. We'll let you actually start comparison shopping for the best price as well, at both doctors' offices, hospitals, and soon-to-be urgent care centers. So how does this transparency affect our users? We're happy to say that we're already starting to impact how people feel about that connection to their doctor. We did a survey last month and found that 42% of respondents felt more confident about their choice of a doctor after looking them up on Vitals, while another 7% felt they needed to find a new doctor after viewing his or her profile. At Vitals, we can't promise that you won't get sick, but we can help you feel better about the health decisions that you'll be faced with. With access to better data, user ratings and reviews, and accessibility. Vitals, we're helping you find the right doctor at the right time for you. Thank you.